The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, today on Aging Horizons we're going to be talking about one of my favorites, Medicare. We have with us the state SHIP director, Janet Stillman, and she's going to be giving us all the updates we need about Medicare Advantage, some enrollment periods that are going on right now, and just a little extra information to let you know what you get when you have that Medicare for a benefit. Stay with us.
Flight 109, is that Evel Knievel on the runway?
Whoa, Daredevil! You need a Montana Real ID to fly. Go to mtrealid.gov to make an appointment.
Looks easier than jumping a canyon.
Smile. I see you changed your name from Robert to Evel. Did you bring your name change documentation?
I'm not trying to pull a stunt. Got the paperwork right there.
Go to mtrealid.gov.
Now I can fly! It's that easy.
My goal is to keep my patients safe, and my goal from the beginning has always been to keep my patients safe. Most of the time, these are elderly people. Taking care of these people, it terrifies me, and I'm scared for patients who are not vaccinated. I'm petrified for these folks because we just see how quickly they can go down in flames. But the way out of the pandemic is the vaccine, and we have it. It's at our grasp. We can end this. Game over if we get enough people vaccinated.
No one likes to have to ask for help. It's a courageous act.
Sarah Solomon, Energy Share Coordinator.
Our clients work hard, sometimes at 2 or even 3 jobs, but still struggle to keep the heat on. They're doing everything they can. They're proud and they don't give up. I feel inspired and honored to work together with these Montana families.
To donate, call 888-779-7589 or go to EnergyShareMT.com. Energy Share, you can help your neighbor stay warm.
Respite care is amazing. If you are capable of doing it, the rewards are beyond measure.
Stephanie Young, respite care provider, on the unexpected benefits of helping people in need.
Being a respite care provider is an amazing experience. It's something that what you give, you get back 100-fold. You receive so much more than you could ever imagine.
To find out how to change lives, including your own, go to respite.mt.gov.
Hello everyone, welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and today we're going to be talking about Medicare, one of my very favorite subjects, obviously. And we have with us the state SHIP director, Janet Stillman. Janet, welcome. Good to have you.
Thanks for having me.
You betcha. Before we start with some of our other information, can we please just have a little thumbnail sketch of what SHIP means or what it is?
Sure, Kimmy. SHIP stands for the State Health Insurance Assistance Program. We've been around since about 1992, I think, and SHIP got started because the Congress introduced Medicare supplements, and they were very confusing, and so they thought that the Montana or states needed programs to help people get through that maze of Medicare supplements and stuff. So SHIP's been around since 1992. We have over 100 counselors throughout the state that are trained in Medicare. So, and our main goal is to help Medicare beneficiaries and to be a confidential, one-on-one, unbiased,
nothing to sell, objective
person that's in their local community that somebody can turn to get help with their Medicare. It can be the beneficiary themselves or their family. It is a nationwide program, so every state has a SHIP program. It may not be called SHIP, but most of the states it is SHIP. So.
Okay, well, great. So I wanted to ask you a little bit about Medicare Advantage today, because we know that there's a enrollment period that's going on for that right now. Can you tell us a little bit about what that is and what the enrollment is all about?
Right. The Medicare Advantage open enrollment period is January 1st through March 31st. So this gives people an opportunity to switch their Medicare Advantage plan or go back to original Medicare and pick up a Part D prescription drug plan. So just to back up a little bit, a Medicare Advantage plan, so there's two modes to get your Medicare. You can either go the traditional model, which is you pick up a Medicare Part A, Part B, and probably a drug benefit or Part D.
Right.
The Medicare Advantage plan is Medicare gives these companies a pot of money and says, okay, you take care of their Medicare costs throughout the year, and we're going to give you this pot of money, and spend it wisely.
Well, yeah.
So the Medicare Advantage, sometimes known as Part C, it includes your Part A coverage, your Part B coverage, and usually a drug benefit coverage, so Part D. And it also includes a little bit extra sometimes. So it has to cover everything that traditional Medicare covers, but it may cover it in a different way.
But you're still a Medicare beneficiary, right?
Right.
Even though you're not taking the original.
Right.
Okay.
And so traditional Medicare is 80-20 split. So the Medicare beneficiary is responsible for 20% of the cost. With Medicare Advantage, it's usually a copayment. So every time you go to a doctor, it could be zero copayment, or $10 or $20 copayment every time you go to the doctor. Every time you go to the emergency room, it's a flat $250 or something. So you kind of are more aware of what your costs are going to be.
Of course, yeah.
Rather than the 20%.
Sure.
I think the biggest thing about Medicare Advantage plans that I find beneficial is that there's a maximum out of pocket.
Oh, great.
So it's like once you've spent out of pocket this much, the company is going to pay the rest.
And then that turns over every year.
Right.
Great.
So let's say the maximum out of pocket is $6,000. You have a hospital bill and it's $100,000. Hopefully not, but
yeah, right.
You're responsible for $6,000 of that bill. That's it, and then the company is going to pay the rest. So that's one of the
big advantages to Medicare Advantage.
Yes.
Yeah.
Yes. So
and also there's another general enrollment that's going on right now. Can you talk a little bit about that too?
Right. The general enrollment period, again, it also runs January 1st through March 31st. That is for people that didn't sign up for Medicare Part B when they first were eligible or first became eligible to sign up for Part B.
Right.
So they can sign up January 1st through March 31st. However, it won't begin until July 1st. So this is the only time to get into Medicare B during the year unless you have a
credible coverage to it.
Yes,
okay.
or a type of special enrollment type thing.
Exactly.
Which there's very few of those. So it's really important to sign up for Part B when you're first eligible for it.
Yeah, and especially if you have to wait months to get that benefit to start,
right.
You should sign up as soon as you can.
Right, and we know that Medicare has a penalty if you don't sign up when you're first eligible. So with Medicare B, it's I think it's 10% per year that you weren't in Part B when you should have been. So
and that stays with it forever, doesn't it?
And then by signing up January through March and not having a start date until July 1st, that just adds another 6 months onto your penalty.
Sure. So in our last couple of seconds here, let's just talk very briefly about, okay, you're in this position, who do you call?
You call your SHIP counselor.
That's right.
There's a SHIP counselor in every community. They may not live in the community, but they cover the community, and they're located in the area. Most of them are located in the area agencies on aging.
Right. And you can call, get an appointment on the phone, maybe come in if that's what you prefer. And these are people who, even though in a small community you may know them, it's still confidential there's never anything said about it to anybody else except you.
Right. That's correct.
And so SHIP counselors are just very objective and really take that seriously, that confidentiality. Folks, we're going to come back and tell you some more about the wellness benefits with Medicare. It's a new year and you want to start it out right. So stay with us.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare Preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
Hi folks, welcome back to Aging Horizons. We're here talking about Medicare today with our state SHIP director, Janet Stellman. Now Janet, we were talking the last segment about some enrollment kinds of things. So let's say now you're enrolled and you're brand new to Medicare, let's say. There's some great wellness benefits that are now part of Medicare. Can we talk about that a bit?
Right. The first one is during your first 12 months of being on Part B is your Welcome to Medicare Preventative visit. This visit is, a visit with your doctor, and it's just going over, talking about what's going on with you right now, what kind of medical issues you have. It also gets kind of a baseline of where you're at, where you're starting at in this Medicare journey, where your health is at. Mm-hmm. So they might take, they'll take your blood pressure and they'll
talk to you about family history and
right, and
all that.
And you'll come up with a plan of what kind of tests you might need or what kind of procedures you need to be, might want to get done, or just kind of a plan of where you're going to go with your health, or, trying to keep you healthy, because Medicare likes you healthy.
Well, and we all like to be healthy. I mean, we want to take proactive steps as opposed to reactive, I guess.
Right.
And with the wellness visit, is there a charge for that?
No, it should be no cost to you as long as you're going to your provider that accepts Medicare.
Right.
So.
And I think we also want to just point out that if you get to one of these and something is found that you have to have a bunch of tests and stuff for it, that's
right.
Goes on to be covered by Medicare. That's not.
Yes, it's
that's
extra.
Not part
you
of it.
might have co-payments. So it's also important to, when you're making this appointment, make sure you tell them, hey, I want my Welcome to Medicare appointment.
Yes.
Because otherwise they may not know, and you may get charged for it if you don't specify
Well,
that.
and we both know that for a long time, lots of providers didn't really know about the Welcome to Medicare, but now they do.
Right.
It's been around long enough that now they do. And if you mention that, then you'll be charged the right way, which is not being charged.
Right.
Right? Okay, so then also there's an annual sort of checkup. What's that about?
Right. This is your yearly wellness benefit. And so if you've had Medicare Part B for over 12 months, and you can get your wellness visit. And this is just kind of a time for you and your doctor to update your plan that you made at the Welcome to Medicare appointment. So
Sure.
they'll ask you, they'll ask you questions and do a health risk assessment, and just go over the things that you went over the first during your welcome to Medicare exam, and they'll just update that plan. One of the things I forgot to mention, they also talk to you about, do you have your legal documents in place too?
Oh, great.
So that's good too, because that's so important that
right,
to get those done. So
yeah,
they'll
right.
discuss those a little bit too.
And what are some of the, because I know there's a big long list of sort of benefits, different testing and things that can be done, things like, I don't know, mammography and things like that. Are those part of the wellness?
Well, the wellness visit it includes education and counseling about preventative services, including certain screening shots or vaccines. So flu shot, your pneumonia, or other recommended shots or vaccines, and referrals to other care or providers if needed. So.
And they're also, don't they do sort of the doc does a sort of a cognitive, they sort of are listening for cognitive things as well to see if there's other things going on besides just physical.
Right, and kind of get a baseline of where the person's at, and then the next year just make sure you're trotting along.
Yeah,
so.
yeah. You know, and I agree with what you said, that Medicare wants people to be healthy, and they've come so far with these wellness benefits that it's crazy not to take advantage.
Right.
Right? Well, what if you don't really know? You don't really, you know, I don't have a computer at home. I don't know how to look this up. What should I do to find out?
Well, you could call your SHIP counselor.
Yes.
And they can talk to you about the Welcome to Medicare and the annual wellness visit, and just kind of let you know what it's about and how to go about, making that appointment with your doctor.
Well, and also, I think you should always talk to a SHIP counselor, but you can also ask your doctor's office staff.
Right.
Because they are going to know if they take Medicare.
Right.
What's out there for folks and what you should be keeping up on.
Yeah.
Yeah. Okay, anything else about those wellness visits that we should be aware of, Janet? Just
that they're really important, yeah.
Yeah. And I know we were going to talk about this a little bit later, but also part of the benefits now includes telemedicine.
Right.
Through Medicare. And that's been so great for so many people, especially in the pandemic. And they're really okay with using that.
Right. And it's be getting more and more prevalent, with the pandemic that we're going through, and people are finding that they like calling or video conferencing with their doctor instead of having to actually go in. Sometimes it's more convenient, and it also keeps you safer.
Amen. And today it's about 20 below, and it would be nice if you had a doctor to stay home and just do that video call.
Right.
Folks, your Medicare benefits are so important and you've earned every one of them. You should take advantage fully of all the wellness benefits of that Welcome to Medicare checkup, that annual checkup, all the things that can give you a baseline and let you know where your health is moving towards, especially if you have family history that you want to make sure you keep an eye on. Stay with us. We have some more to talk about before we go. Be right back.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline 800-272-3900 for guidance and support.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium. To learn more about extra help and Medicare savings programs, call your local SHIP counselor today. Maybe I better text him.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Hi folks, welcome back to Aging Horizons. We're talking about Medicare today with the state SHIP director, Janet Stellman. Janet? Let's talk about helping programs, because that's a biggie that goes along with Medicare, Medicaid, or just Medicare. Tell us a bit about that.
Well, the Medicare helping programs are my favorite things to talk about. So our counselors are trained to, every time they meet with a new person, they screen them for these helping programs. So we know that Medicare costs can be expensive. There's a few helping programs that can help people with some of those costs. The first one I want to talk about is the Low Income Subsidy, or LIS program. That is a program that helps people with their Medicare Part D, their drug benefits. So if somebody is eligible for Low Income Subsidy or LIS, or extra help too, it's also called that. So it helps pay the deductible. It helps pay the co-payments, and it helps with all the way through that the coverage gap that's no longer there. But it helps with those costs. So traditionally, costs, you're paying whatever the pharmacy and Medicare have decided you're going to pay. But with low income subsidy, your co-payments are anywhere from $2 to $9 for the drugs that are on the formulary.
Super.
So that really can help people. It can really make a big difference. The second program that we like to talk about is the Medicare Savings Program. So the Medicare Savings Programs are administered through the state Medicaid office. However, SHIP counselors can help you apply for those. The Medicare Savings Programs helps with that Medicare Part B premium. As we know, this year, Medicare beneficiaries took a big hit with their increase in their Part B premium up to $170 something a month. Up from $148.
That is a big hit.
These programs are more important
than ever.
Right.
Yeah.
Because what it can do is it can help pay that $170 Medicare premium. There's 3 different levels. There's QIMBY, SLIMBY, and QI. I call QIMBY, or the Qualified Medicare Beneficiary, is for folks that are lower income, and it pays the Medicare Part B premium, but it also would pay the Part A premium if somebody didn't have premium-free Part A.
Gotcha.
And premium or Medicare Part A, the premium is like $400 and some a month if you don't get it premium free.
Right.
So that's a big help. Also, the biggest thing with QMB is it acts like a supplement to Medicare, because it's going to pick up that anything that's covered by Medicare, that 20% that you're responsible for, QMB is going to pick it up.
Wow.
So it acts like it's, having a secondary insurance to Medicare.
Right.
The other 2 programs based on income and just pay the Medicare Part B premium. But well, boy, what a big help. I mean, especially now that it's $170 a month.
Yeah.
Ugh.
Yeah. That is a big help. Yeah.
And if somebody's on the Medicare Savings Program, they're automatically eligible for the Low Income Subsidy Program, or that extra help paying with your prescriptions. So that's
And also, those folks in those programs get some special enrollment rights.
Right. So if somebody gets into a plan and they're not really happy with the plan, or it's not covering all their drugs, they get what's called a special enrollment period. And the first 3 quarters of the year, they could change once per quarter. And then the 4th quarter is, of course, open enrollment for the following year. But they could change plans where some people that don't qualify for a special enrollment period, they're stuck in that plan for the whole year.
Yeah.
So
another reason to talk to a SHIP counselor before you sign up.
Right.
And get as much information. Now, is the SHIP counselor going to pick that plan for you?
Nope, the SHIP counselor will never pick a plan for a beneficiary, nor will they tell them which plan to pick. It's going to be up to the beneficiary. We can show them the different options, and it's ultimately their decision.
Right, exactly. And there's another helping program that's a state program that we really love.
Right, we like to talk about that one. It is Big Sky RX. It's a Montana homegrown program. It was created with the Montana tobacco tax, I think under the Schweitzer administration. And basically what it is it's for people, Medicare beneficiaries that have a little bit higher income that usually don't qualify for anything, but it has a little bit higher income limits, and they don't look at resources or assets or things you own. And what it does is it just pays that Part D, or that drug benefit premium, up to $36 or something a month. So it's not a lot of help, but it's $36 back in your pocket.
And as you were saying, Janet, it's for folks who don't normally qualify for other things.
Right.
So I would imagine that they love the help just as much as anybody else.
And also being on Big Sky RX, they can qualify for a special enrollment period, 1 per year. So if they're not happy with their drug plan, they could switch 1 time per year. Also, there's 2 ways the Big Sky RX can either pay the company directly that premium, or they can reimburse you.
Oh, wow. That's so easy.
Yes.
So, okay, we just have a few seconds left in this show. We've talked about a lot of different things, but the basic thing is call a SHIP counselor, right?
Call a SHIP counselor,
We're going to run that number on the screen. They're going to help you. They're going to be objective. They're not going to pick for you, but they will give you information.
Right.
And they're all over the state.
And they have a lot more information than just Medicare, too.
So exactly, because you mentioned that they're looking and listening all the time for if there's anything else that you might need.
Yep.
Well, Janet, thank you so much for being with us today.
Thanks for having me.
Yeah, absolutely. And folks, remember, you earned these Medicare benefits. Use them to your fullest ability and look into those helping programs. For Aging Horizons, I'm Kimmy Everman.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.